the cardiac program here in Barrie. So I don't need to tell you guys all of this, but Barrie, as you know, is a growing population, currently about 140,000 people, fairly close to the GTA, which has significant care implications for people in our region. And it's close to some pretty substantial neighboring communities like Collingwood, Innisfil, Orillia, and Muskoka. And there's substantial growth that's going to be happening along the 400 corridor. So it's interesting our position in this community because we're not actually that far away from the large teaching hospitals in downtown Toronto. So if people have major trauma, you see so much helicopter driving into hospital, they see people downtown. People who have catastrophic neurologic injuries go downtown. And for the longest time, people with advanced cardiac issues would head down to South Lake or down to Toronto for their care. And it wasn't that big of a deal. But as our population grows and as patient care needs to become more complex, it's become more and more important to have that care be delivered closer to home. So our current health LIN, who knows what's going to happen with the LINs in this new Ford administration, but right now the health administration unit covers about 450,000 people living all over the North Central Muskoka region. And there's going to be tremendous growth over the next 20 years, particularly in the South Simcoe region, with a lot of new people coming in, and we need to make sure that we're prepared to be able to deliver on their care needs. Why is it important in this region that cardiac care be addressed? This is a map of Ontario based on the health LINs, all these regions. And so some researchers looked at your incidence of having a heart attack or a stroke or dying of cardiac death between the years of 2008 and 2012. And you can see we are in the orange, we're in the orange area right here. Everything orange is bad. That's bad. It's a high incidence of cardiovascular events. And so you can see that the white areas are the lower rates of having a bad thing happen to you. And that tends to be in the GTA where all the large hospitals are and the population is most dense. And it's important because if you have a heart attack, you call the ambulance. The ambulance comes and gets you, and if it's the highest risk kind of heart attack, they take you directly to the cath lab and they bypass the emergency department and they open the artery up. So you can imagine that being close to a large urban center has implications for care and how you're going to do over the long term, and certainly that plays out. So more remote or more rural regions have worse outcomes vis-a-vis their cardiac care because the transfer times are longer. And patients who would live in an urban center have access to these services tend to do better. But it's more than just that. People and so here's some of the numbers if you're interested. Our number was around 4.8% per year of having a bad thing happening, where some of the lower ones were like 2 to 3%, so significantly higher. But the bottom line is that it's more than just having access to some of the advanced cardiac care and the balloons and the stents. People in our region don't have as much access to public health, don't have as much access to family care. There are high incidence of smoking and diabetes and blood pressure. And if you did have those things and were seeing a doctor, you had a less chance of being on the right dose or getting to target with some of your blood pressure numbers or cholesterol numbers or diabetes numbers. So a huge need was recognized in this area, not having the right access to the services that were required. And so, furthermore, politically, it was a bit of a hot potato because our LIN is the only LIN in Ontario that does not have access to a cath lab and a STEMI program. And STEMI refers to that highest risk heart attack where the artery becomes totally plugged up over a period of 5 to 10 minutes and the patients are struggling for oxygen. That's where every minute counts with respect to muscle in the heart. And so over the last decade or so, there's been a lot of planning and fundraising going on, many of which have been done by people like yourself to help raise awareness and raise funds for the hospital through the Hearts and Minds campaign, as well as at a political level to get the political inertia moving to get a program and to make sure we have enough support services. So our hospital, RVH, is a growing hospital. I mean, we moved to the new site in, I think, 97, and then there's a major addition put on in 2012. Many of you are familiar with that. But we are now a regional health center, and when you're a regional health center, you have some responsibility to your region to provide care, not just to the patients in your city. So we have many regional programs at the hospital. We have regional cancer care, now regional cardiac or regional renal program, vascular surgery and interventional radiology are all regional programs as well. And the hospital does have a 20-year plan, many of you which may be familiar, to look at how is the hospital going to be able to grow and respond to this massive expansion that's going to be happening in South Simcoe. With respect to the cardiac program, prior to 2013, which is still, modern era, there was really only 2 cardiologists who were hospital-based in the city who provided a lot of good work. But the population is growing and the program had to expand. And so at that point, there was a partnership made with Southlake, which was the closest hospital to our region that had advanced cardiac care, so balloons and stents, cardiac surgery, and more advanced heart rhythm treatments. We created a partnership with them to develop a standalone PCI program. What that means is a hospital is a standalone program when you put in balloons and stents without the need for backup heart surgery. You have to remember that when stents first came into the fore about 20 or 30 years ago, in some cases you got emergencies and you need to go to the open heart operating room to bail you out. Now the technology is so advanced, less than 1% of patients require emergency bailout of open heart surgery, and you can fix your own mistakes in the cath lab with balloons and stents. And over the next 6 years, we've recruited 9 cardiologists to the program to help meet the care needs. And it's not just building the cath lab and getting the balloons and stents. We also had a mandate from Southlake and from the government to create the entire infrastructure to be able to look after patients. It's not just enough to put in a stent and send people back to their family doctor. You actually have to make sure that you're following people over time, making sure people stay on the right drugs or adjusting their medications based on side effects, and testing and follow-up testing to make sure that people have their appropriate cardiac needs met. And so that's what I do. I'm a general cardiologist. I don't actually put balloons and stents in. I don't work in the cath lab. I work in the coronary care unit. I look after patients with heart disease or valve disease or congestive heart failure, or maybe somebody who hasn't had any of those things, but maybe at risk for developing them. So thankfully, I don't recognize too many faces in the room, so that's good. That's generally a good thing. So to tell you a little bit more about our program, in our cath lab, we have 2 cath labs that are now open, and we do 8 procedures a day. The second one just opened up, and that will be coming online shortly. And to help people recover, we have 10 recovery bays in the cath lab, and we have 6 bays that are specifically dedicated to regional patients. So if you have a small heart attack and you present to Midland and you need to come for an angiogram, you can now come to Barrie instead of going all the way down to Southlake. And then you might have a stent here, you might stay overnight and then go back to the Midland Hospital or really a hospital in the morning to make sure that everything is settled out. Our CCU, we're the only standalone CCU in the region that's staffed by cardiologists. There are several intensive care units, but we're the only cardiac specific one in the region outside of Southlake. We provide 24-hour, 7-day-a-week call coverage to the hospital. So if somebody comes in with a cardiac problem at 2 in the morning, there's always a cardiologist available to review the case or chat with the emergency room physician and help provide care. We have a 32-bed cardiac renal ward that opened up a number of years ago with the new expansion. We have a lot of telemetry beds. We can do urgent dialysis. We also have an urgent cardiology clinic that helps divert the admission. So not every patient who comes to the hospital with chest pain will get admitted to the hospital. We have a clinic that can see people at the hospital to help expedite their workup and see a cardiologist and get some cardiac testing really soon. And that helps minimize the burden on admissions to hospital and helps the flow of patients through the organization. We also have a heart function clinic, so if somebody has had a heart attack and has damage left over from that heart attack, they can be at risk of having lots of complications related to that over time. So we have a nurse practitioner and physicians who work in the heart function clinic to see people and help manage those issues more acutely. And we have a cardiac rehab program, so that's one of the most common things that people ask me after an event is, what can I eat, how do I exercise, how do I get back to real life? And that's what the rehab program really helps excel at, getting patients back together again. We also are fortunate to have state-of-the-art cardiovascular diagnostics. We have a very high-quality echocardiography lab. So echocardiography is ultrasound images of the heart that looks at the structure and function of all the valves and the walls and function of the heart. That currently does around 2,100 studies a year. We do transesophageal echocardiograms at the hospital, so some questions you don't get good pictures, or the question isn't answered, you actually have to swallow the ultrasound probe, just like an upper scope, to get better images of the heart, so we do that at the hospital. And there's all sorts of fancy, high-tech technical issues that help us take better pictures or more precise images to help answer the questions, particularly in patients going for specialized heart surgeries like the minimally invasive valve surgeries or the clip procedures that are done at South Lake. So we can get all the testing done preoperatively locally, and then patients just have to go down to South Lake for their operation. And because of our partnership with South Lake, the surgeons and the interventional cardiologist team down there, they can actually review the images on the web in a patient-safe manner so that they can actually look at the images so they know exactly what they're dealing with. We also have all sorts of stress tests and pacemaker clinics as well in the hospital. So overall, the growth of the program has really been exponential since 2013, with all sorts of new aspects of the program coming online frequently, and various health team members coming on. So currently, we just hired another nurse practitioner for the cardiac program. We just got more funding to hire more nurses for the cardiac renal work, particularly on nights. Change has really been the name of the game in our program over the last several years. So we spent a lot of time, that's my administrative job. So it's out looking after patients. I'm working at the hospital to help make sure that the quality metrics are being met, that we're not growing too fast, that we're ramping up safely, to ensure that the program that we're building is as one of a solid foundation to really set the stage for the next phase of growth in the next 10 to 20 years. So what's going to be happening over the next 3 to 5 years for the program, and what can you expect from your hospital and the cardiac program at RVH? So the cath lab opened up in January of 2018. That's when we did our first cath procedures. And to date, we've performed over 2,100 diagnostic procedures. So that's just taking a look at the arteries with an angiogram to have a look to see if there's any blockages. And we performed over 400 stenting procedures. As you can expect, with our relationship and partnership with South Lake and the government, we just don't open the doors and let the floodgates come in. We have a ramped up approach in terms of number of funded volumes, so the government will pay for only so many procedures. And patients who need other ones, we work with South Lake to make sure they're either done at RVH or South Lake to get done. And we don't really want to disrupt the patterns of care that have been well established in our region, so we work very slowly and carefully to make sure that our program is well established and poised to provide safe care for our patients. Currently, though, many of the acute coronary syndrome or heart attack patients who present regionally in Muskoka or Orillia or Collingwood or Midland can actually get their balloon and stents right now at RVH, which is fantastic for patients because it's care closer to home. Later on this year in October, we will be doing walk-in STEMI cases, which is if you have a heart attack and you just randomly show up to the emergency department at RVH and it's the highest risk heart attack, we will take those patients right up to our cath lab. Historically, what would happen is the emergency department would recognize that it was that bad heart attack. You would get, shipped right away to South Lake. So you can imagine in any sort of complex system where you have nurses and paramedics and physicians, even things like not taking the patient off the paramedic stretcher can save time and save heart muscle and improve outcomes. So anytime you have to transfer a patient between organizations, it's a bit of a headache, making sure there's a paramedic team to carefully take the patient down the highway. We've had instances where the highway's been closed or bad weather, and this will allow a much safer delivery of care. By April 2020, we will be going live 24/7. So that means if you're at home, God forbid, you have a heart attack, and you call 911, the paramedics will just bypass our emerge and go right to our cath lab, which is actually a fantastic change. So historically, what would happen is you go to the emerge, you get usually clot-busting drugs, which is sort of a Band-Aid kind of solution, which only works 7 out of 10 times. And then you go down to South Lake for your balloon and stent. So you're just hoping that everything kind of goes out okay, but this will allow much closer care, much faster care. And then over the next several months after April, we will be doing a phased-in ramp-up approach with the paramedic services throughout the North Central Muskoka region. This is really exciting for us and for our paramedic colleagues because this is a major change in the care for them. Historically, there are certain guidelines in terms of 1 hour, 90 minutes, 120 minutes. If the horse is out of the barn and the heart attack is already well advanced, there's no benefit to opening up the arteries, and those patients just go to the hospital. So that's why it's important to remember to seek out medical attention right away when you're having the worrisome chest discomforts and calling 911 rather than driving into the hospital. And then 2020 and beyond, we'll be again rolling out that to the rest of the region. And that requires training for our paramedic colleagues who have not had to do this, so to recognize these high-risk heart attacks and bring those people in I mean, they're all trained to do that in school, but they've never had to use that in their current care systems. And so it's a major sea change for these organizations to get geared up and ready, and that's part of the reason why we're doing a ramp-up approach. As well, it's going to be a major influx of patients to the organization that we haven't seen before. Most of those patients we don't even see. They come in from the field and paramedic, they go right to South Lake, and they don't even come to the RVH organization. And so we need to make sure that we are ready to handle that extra volume, all the way from housekeeping and portering and nursing and physician staff. The other side of the coin, you can imagine the heart is like a house, right? There's the plumbing, and that's the heart attacks and blood clots. The electrical system is also an important foundational service that we provide. So currently we do have a pacemaker clinic, so anybody walking around with a pacemaker can get their pacemaker checked at RVH, and we see about 1,600 patients a year there. But we do not have the ability yet to implant a pacemaker. So if somebody comes in with a dangerously slow heart rhythm and they fainted or blacked out or whatever, they have to go to South Lake to get their pacemaker device, which is about a 20 to 30 minute procedure. And we will be able to offer that this fall at RVH with single and dual chamber pacemakers, which is a really nice thing. Most of the people who require pacemakers are elderly, and so it's nice to have all that stuff just right here. There is a lot more to the electrical system than slow heart rhythm, so that more complex stuff will remain at South Lake, but by diverting some of that bread and butter straightforward things to RVH, excuse me, that opens up South Lake's capability to provide more advanced ablations and rhythm control strategies so that they can look after more of our complex patients. So what does the future hold over the next several years? So the hospital has designs to meet the needs of the South End by opening up a satellite center in the South End and an ambulatory care clinic, progressing all the way to a fully functioning hospital on the 5 to 20 year horizon over time. But even at the main campus at the north end of the hospital, we do have significant capital improvements that will be coming, so more nurses on the cardiac renal ward, expansion of the cardiac care unit, expansion of the cath labs, all of which kind of come into play on the 10-year plus mark to make sure that we continue to grow in a sustainable way. So what happened? People always ask me, what are you guys going to do heart surgery at RVH? And the answer to that question, honestly, is we may never do heart surgery. There's been so many advances to percutaneous or stent and catheter-based procedures, like Dr. Baxter mentioned, that the valves are implanted with the catheter. You blow up the valve similar to a stent, or you clip the valve and hold it together if it's leaking. So there's many procedures that can be done percutaneously now, through the skin, through the groin, up the artery, and delivering the equipment. So we may have to do less and less heart surgeries in general. But we don't have any plans for open heart surgery at this point, but who knows what 20 year plus, medicine changes all the time. And then some of the advanced electrical heart rhythm stuff will stay localized at South Lake for the foreseeable future as well, because that's our center of excellence and they do a really good job with that. So our mission really is to excel at bread and butter cardiology. I know it's been billed as advanced cardiology, advanced care, but as a cardiologist, I can tell you the services that we're just beginning to offer now are really bedrock in cardiology, and to be able to provide that service where it was quite limited in the region before is a real honor for us to deliver that care. So we have been very reliant in terms of all of the capital purchases for our equipment and a lot of the operating funds. You can imagine we get funding from many different sources, the government being one, but our foundation is another major one. And the Hearts and Minds campaign had many contributors throughout the community, so we're deeply indebted to supporters like you guys who help raise money and raise awareness for the programs and services that we offer at the hospital, so thank you very much. But you can imagine government support is always fickle. Every 4 years there's new people involved, and any decision making is delayed until the new government gets settled and funding can come and go. And so we, that's the nature of healthcare in the province, and so we have to work within those limitations. But that's really what I wanted to provide, was an update on the program. If I didn't take any questions or if anyone has any concerns. Yeah.
Does having level 3 paramedics increase your ability for success? And if so, does Central County have adequate numbers of level 3 paramedics to support you?
So there's a number of different levels of paramedics. There's like a basic care paramedic and an advanced care paramedic. So for us, an advanced care paramedic is someone who can perform more advanced life-saving procedures, defibrillation, and specialized drugs to use in the field to look after sick patients. So for us, any paramedic really needs to be able to recognize who would be assigned to a chest pain call, would be expected to recognize some of these higher risk ECGs, the surface stickers that people get in the big squiggly line, and transport those patients into the hospital. As well, we often rely on our patients on the paramedic service to inter-hospital transfer. So if we have someone who's critically ill at our center who needs more than we can offer, we have to shift them either to Toronto General or the South Lake. So having those people around are critical, and we've been working with the paramedic services at Simcoe quite closely with their management team to make sure that they are geared up. But simple things that, as a cardiologist, I wouldn't even realize, making sure that the paramedic buses, the ambulances themselves are equipped to handle the specialized equipment that may require, that they may see within a hospital transfer. So we had to make sure that the nuts and bolts on the ambulances were in the right spot to be able to strap down the equipment. So all of that detail work has to get done before we can go live with that program, which a lot already has been, but right now I think we're well poised with the Simcoe team to get ready, and we'll have to do all that stuff with the other paramedics as we go on as well. Any other questions? Yeah.
You know, I had to valve replaced with a TAVI procedure, which is the transaortic valve implantation. It was all done with catheters in less than 2 hours and home the next day. Do you think that will come here eventually? That procedure being done?
Yeah, I'd love to say yes. I'd love to say yes. So much of the really high risk things like TAVI or valve intervention right now are funded on a special access program. So because like the TAVI really wasn't even invented until 2012, really didn't become mainstream in Canada until a couple of years ago. And so the government really doesn't have a funding model to do it. So what they do is they give batch funding to hospitals, and they have to meet certain quality criteria, they have to maintain certain volumes. And so the way that it works is we kind of have a hub and spoke model with some of these more higher level things. Where centers have to really develop an excellence in it. And you have to do so many procedures to be really good at them, because even though it sounds really easy, there's lots of technical nuance to making sure that the patients have a good outcome. I don't think at this point we're going to see that in the short term. After 20 years, who knows? I think nobody can predict the future that far ahead. And we may yet get some of those things, but for now, in the short and medium term, all of that will stay localized to South Lake and places like Sunnybrook and St. Michael's, because they can do such high volumes that their complication rates are quite low. Whereas with the stenting and coronary disease, there's so much coronary disease running around that our operators are all highly skilled and have lots and lots of volume work. Yeah. Any other questions?
Dr. Steve, it's my pleasure on behalf of the club to thank you for your very informative presentation today on both RVH and the cardiac care program. As a former chair of the foundation board at RVH and a member of the Hearts and Minds cabinet, it's really exciting to see something that was an idea a few years ago that has now come into fruition. And I know I speak for a number of people in this room. Also, in spite of what you thought, there is a very youthful look to this crowd.
Heart disease affects everybody.
But several have had a bad thing happening, as you described it, and I think that those are very happy and comforted to know what is going on at RVH in terms of the cardiac care program. And for the rest of the club, we are excited that RVH was able to attract a young, bright cardiologist like yourself to come and work in our community. And thanks for coming home.
Yeah, thank you very much.